In a major shift in national health policy, the U.S. Department of Health and Human Services, HHS, and the Centers for Disease Control and Prevention, CDC, announced a significant revision to the childhood immunization schedule that will recommend fewer routine vaccines for American children. Under the updated guidance, routine recommendations for immunizations against diseases such as influenza, flu, respiratory syncytial virus, RSV, rotavirus, meningococcal disease, and hepatitis A and B are being scaled back. These vaccines will now be recommended only for children at higher risk or through shared clinical decision-making between families and healthcare providers, a departure from universal recommendations for all children. The number of diseases for which vaccines are universally recommended for all children has been reduced from 17 to around 11. Vaccines still included as routine for all children include protections against measles, mumps, rubella, polio, pertussis, whooping cough, diphtheria, tetanus, pneumococcal disease, Haemophilus influenza type B, varicella, chickenpox, and HPV. Policy rationale. Officials cite multiple reasons for the overhaul. A presidential directive from President Donald Trump, issued in December 2025, instructed HHS to review international vaccine schedules and align U.S. recommendations with practices in other developed countries. CDC leaders said the change aims to restore public trust, improve transparency, and give families and clinicians more tailored decision-making power.
We should not be capitalizing on people's illness. We should not be scaring parents. We should be caring for them. Instead of celebrating vaccinations, they're demonizing vaccinations. And hepatitis B is no joke.
What is the consequence if the CDC cannot be relied on by the everyday parent, person, potential patient?
Well, there'll be more confusion. And the problem with confusion in vaccinations is as the vaccine rates drop down, say, under 95%, you'll see outbreaks because we won't have herd immunity. So confusion is our enemy in this case. If they make it more difficult to get vaccinated, we'll have people suffer the consequences of very serious viruses. I don't understand why they continue to push down on vaccinations. It's a mistake. Vaccinations and childhood health should be off limits when it comes to politics. And obviously, it is right now at the center of politics, and that's disappointing.
Importantly, federal officials stress that insurance coverage for all vaccines, including those no longer broadly recommended, will continue without out-of-pocket costs for families under programs such as Medicaid, CHIP, and private plans. Public health experts have reacted strongly. Major medical organizations, including the American Academy of Pediatrics, warn the changes could confuse families, lower vaccination rates, and increase the risk of outbreaks of vaccine-preventable diseases. Some critics emphasize that the overhaul occurred without the traditional review process by the CDC's Independent Advisory Committee on Immunization Practices, ACP, raising concerns about scientific rigor and transparency.
I think a parent should have their own rights.
Jamile Garcia, a mother of 4, agrees with the state's plan to end all vaccine mandates in the state of Florida.
Because they need their shot, they need their vaccine in order to get an education, and I think that's wrong.
For years, the state of Florida required a number of vaccines for children like measles, hepatitis B, chickenpox, rubella, but now the governor and the state's Surgeon General, Dr. Joseph Ladapo, are working to put an end to that, making it the first state in the nation to do so. Dr. Ladapo is a longtime critic of vaccines. He said the current requirements is an intrusion on people's lives.
Every last one of them is wrong and drips with disdain and slavery. Okay? Who am I as a government or anyone else, or who am I as a man standing here now to tell you what you should put in your body?
Many scientists argue that comparing the U.S. vaccine schedule to smaller nations with different healthcare systems is inappropriate, and that reducing routine recommendations could compromise child health outcomes.
The Department of Health and Human Services is overhauling the immunization schedule for children. The new proposed immunization schedule breaks up vaccines into 3 categories: vaccines for all children, vaccines for those who are at high risk, and vaccines based on shared clinical decision-making, which means doctors and parents can decide what's best based on a child's health history.
For the recommended vaccines, the big ones, polio, MMR, pertussis, whooping cough, HPV, varicella, which is the virus that causes chickenpox, none of those recommendations have changed. They have now sort of subdivided the rest of the vaccines into recommended for high risk and recommended after shared decision making. The one that really stands out here, Kate, is that they've moved the flu vaccine to one that is recommended after shared decision making.
We spoke with infectious disease doctor Eileen Marty, who says this decision could have serious ramifications.
For those families that recognize the scientific validity and safety of vaccines will have much fewer opportunities and ability to easily vaccinate their children.
The Surgeon General saying it should be the people's choice.
Who am I to tell you what your child should put in your body?
And unlike the mother we spoke with, not everyone agrees, saying this will not only affect the children, but a community as a whole.
These schools are not in a bubble, they're part of our community. And so we know that schools are a great setting for these diseases to spread if there are low vaccination rates, and then that goes out into the community as well.
What this means for families. Access remains available. Families can still choose to vaccinate their children against diseases now placed under risk-based or shared decision-making categories. Healthcare providers will play a larger role in individualized decisions about non-routine vaccines. Parents should discuss all vaccine decisions with trusted pediatricians to understand risks and benefits for their child.